Joining me now live is the Sports Minister, Richard Colbeck. Thanks so much for your time, Minister. This big announcement today that Australian athletes will be vaccinated before going to Japan. How will it work?
Well, the Australian Olympic Committee have their own private contractor, Aspen Medical, who will be providing the service to apply the vaccines on behalf of the AOC to both the Olympians, Paralympians and also the support teams that are going with them. So that's the process. An allocation of vaccines, both Pfizer and AstraZeneca, has been made to cover off on those vaccinations. And so that will be done through the AOC's contractor. So
has the AOC bought their own allocation of vaccines, or does it come out of the shipments that we're getting from Pfizer and the AstraZeneca ones out of CSL?
No, there's been an allocation made as a part of the rollout through Category 1B to the athletes and the supporters for both the Olympics and the Paralympics.
Do you see this as prioritising athletes over some of our most vulnerable?
Well, we've always prioritised our most vulnerable, and they're well on the way to being vaccinated. If you look at the states, the circumstance there is that pretty much all of the frontline workers in hotel quarantine have already been vaccinated. We're well on our way through residential aged care. In fact, every aged care provider around the country either has a date or a 2-week window within which the vaccinations will be completed, and that's will be done in the next few weeks. So we have always prioritised our most vulnerable. They're well on the way, and of course the decision's been made by National Cabinet to bring the Olympians, Paralympians and support crews into Category 1B as a part of that rollout.
Will they be given special quarantining rights, if you like, or exemptions on their return?
My expectation, and I think everyone's expectation, is that they will go through a quarantine process that's similar to everybody else. I know that there's been some discussions in the media, particularly about an AFL style of hub, but my expectation it will look much more like an Australian Open type of exercise where there's the capacity to individually isolate athletes in the case of one of them carrying it when they come home. We don't want it spreading within the hub. That's the last thing we need. So it will be very much a hotel quarantine type of system in my expectation, but my understanding is that the AOC are having direct discussions with the states about that, so that the returning athletes are not within the caps that we have. They are a separate process, which is exactly what happened with the Australian Open. It wasn't within the caps, so it didn't take precedence over other Australians looking to come home.
Okay, that's a really important clarification, that it wouldn't be in the existing caps, it'd be over and above. But of course, because the hotels, the quarantine system is run by the states, they need to do those quarantining systems and negotiations with each state government. I accept that. Now, we have heard from Queensland already that there'll be no special treatment for athletes, that they'll be going into the hotel quarantine system. Is that your expectation, like what happened at the Australian Open, where they go into hotel quarantine outside of the current caps, rather than quarantining in their own homes or a special facility?
Well, that would be my expectation. It would be more an Australian Opens type of quarantine system. I don't see them having any special treatment. I would be very concerned if they were in a AFL hub type situation that we saw, say, during the finals last year, because the concern would be that if one of the athletes does have it and they're mixing, then the opportunity might be for it to spread through the quarantine system. We don't want that. No. We've seen figures over the last couple of days that show how effective our hotel quarantine really is, 99.99% effective, and even despite the fact that we have had some incursions out of hotel quarantine. So we have a very effective system. And my expectation would be that the athletes coming back from Tokyo in a situation where there's highly likely, in fact, it's almost inevitable that there will be COVID at the Games and the potential for our athletes to be exposed to it, that they'll go through an appropriate quarantine process on the way back.
Yeah, indeed, we're seeing an explosion of cases in Japan, not quite as bad as India. But if Japan does become hotspot. Will we still send our athletes to the Olympics?
Well, we continue to watch that really closely because we're very concerned, obviously, about the circumstance that's occurring globally. We're very, very worried about what's happening in India right now, and obviously some measures to support India in managing the outbreak that it's got now. I think if it was 350,000 cases yesterday, that's more than half of the new cases globally, so a really concerning circumstance. We watch that very, very closely. I understand the next version of the Olympic playbook to manage COVID is coming out today, so we'll look at that very, very closely as well. But obviously it's something that both the AOC, IOC and the Japanese government will be keeping a close eye on as well. We want to be able to see the games go ahead if they possibly can, but we want them to see them go ahead safely.
If I could change tack for a moment, because you're also the Minister for Aged Care, and you mentioned the numbers of vaccinations that have taken place in those homes. Now, if you look at the government schedule for those under 1A in particular, you combine the numbers of disability and aged care workers and staff and also residents, and in total that's about 508,000. Can you say how many of that 508,000 have received at least one vaccine?
Well, we're well into, in fact, well over halfway towards 3/4 of the way of getting through aged care residents, which are the most vulnerable and quite understandably, from my point of view, had the priority. And as I said to you a moment ago, we have provided to every aged care provider a date or a 2-week window within which we will complete the rollout of vaccines for their first dose. And of course, then the second dose will follow 3 weeks behind that. So that's well underway.
Can
and
you
of
say
course,
how many in percentage terms?
Well, it's close to 75% that have received a dose in residential aged care. So we're well on the way. And as I said, that will be completed in the next few weeks. So I'm very happy about where that sits right now. And because we've had to undertake a reset of the rollout for staff in particular, because of the guidance around AstraZeneca, we're offering a number of options for access to vaccinations for staff, but both those over 50 and those 50 and over and under 50 to receive the appropriate vaccine through state process inReach and some outreach programs as well. So, and I have to say I'm very pleased with the cooperation and support that we've received from the states in working on that so that we can get those priority classifications vaccinated as quickly as possible. It's really important that we get that done as soon as we can and before winter takes in.
Yeah, absolutely. It is. Richard Colbeck, as always, thanks for your time.
Thanks, Laura.